stop for a moment. Before you finish your coffee, before you take your morning pill, before you walk out that door today, I want you to do something that could genuinely save your life. Walk to the nearest mirror. Stand under a natural light if you can, and stick out your tongue. I know how that sounds. I know it feels almost silly, standing there in your bathrobe, staring at your own reflection with your tongue hanging out like a child at the doctor's office. But I promise you, by the end of this video, you will never look at your tongue the same way again. Because what you're about to see, or what you may have already been ignoring for weeks, could be the earliest warning your body is capable of giving you before a heart attack. Now let me tell you why the tongue. Of all the places in the human body, why on earth would this be the organ that betrays your heart's secret? The answer is simple, and it's something most doctors, even good ones, forget to mention during your annual checkup. Your tongue is one of the only organs in your body that is completely exposed, completely visible, and packed wall to wall with tiny blood vessels sitting right at the surface. There is no thick skin covering it. There is no fat layer hiding it. There is nothing between you and the truth of what your circulation is doing right now, in this very moment. And here is the part that stops most of my patients cold when I explain it to them. Your heart, when it begins to struggle, when the arteries start to narrow, when oxygen delivery starts to falter, does not always send that pain signal to your chest first. Sometimes, and this is far more common than people realize, the very first place it shows up is in the color of your tongue. Not your fingernails, not your lips, your tongue. So what exactly are we looking for? I want you to pay very close attention here, because this is the specific pattern that concerns cardiologists the most. A healthy tongue should be a soft, even pink. Think of the color of a fresh watermelon rind on the inside, that gentle, uniform pink shade. But the tongue that whispers of a struggling heart looks different. It appears pale in the center, almost washed out, like the color has been drained from it. And along the edges, along the sides where the tongue meets your teeth, you'll notice a bluish, purplish, or dusky tint, almost like a bruise that shouldn't be there. That combination, the pale center with the bluish edges, is what we call in medicine a sign of reduced peripheral oxygenation. In plain English, it means your heart is not pushing oxygen-rich blood through your body the way it used to. And your tongue, being the honest little messenger it is showing you exactly that. Now I want you to think back. Have you glanced in the mirror recently and thought your tongue looked a little off? Maybe a little paler than usual? Maybe you noticed that dusky color on the sides and assumed it was from the coffee, or the blueberries, or the cold weather. Did you brush it off? Most people do. And that, my friend, is exactly the mistake that costs lives every single day in this country. I've had patients, good, kind people in their 60s and 70s, tell me after their heart attack, "You know, doc, I did notice something strange with my tongue a few weeks ago, but I figured it was nothing." It wasn't nothing. It was everything. It was their body handing them a warning slip weeks before the event, and they threw it away without reading it. Here is what I want you to understand before we go any further. This is not about panic. This is not about running to the emergency room every time you eat a beet and your tongue turns red. This is about learning to read your own body the way a farmer reads the sky before a storm. Small signs, quiet signs, signs that are there if you know where to look. And the tongue, that muscle you use every day without a second thought, may be the single most overlooked early warning system you have. In the next few minutes, I'm going to walk you through exactly what colors mean what. I'm going to show you the 4 distinct tongue patterns that every adult over 55 should know by heart. I'll tell you why most people check their tongue wrong and miss the warning entirely. And most importantly, I'll tell you exactly what to do the moment you see something that doesn't look right. So stay with me, because the mirror test you just took, the one that only lasted 5 seconds, may end up being the most important thing you do this year. Let's talk about why your tongue tells the truth when the rest of your body is still trying to hide it. Let me ask you something. Have you ever wondered why, when you go to the doctor, the very first thing they do, before the stethoscope, before the blood pressure cuff, before anything else, is ask you to open your mouth and stick out your tongue? It's such a strange little ritual, isn't it? For thousands of years, from the physicians of ancient China to the country doctors of rural America, this has been the first move. And it wasn't tradition for the sake of tradition. It was because those old doctors, without any of the fancy machines we have today, understood something modern medicine is only now rediscovering. The tongue is a window, and what it lets you see, if you know how to look, is the true condition of the heart. Here's what makes your tongue so uniquely honest. Unlike almost every other muscle in your body, the tongue has no protective barrier. Your arms have skin, then fat, then muscle. Your chest has ribs, tissue, layers upon layers of insulation. But your tongue? It sits right there, exposed, with an extraordinarily dense network of blood vessels running just millimeters below the surface. In fact, gram for gram, the tongue receives more blood flow than almost any other muscle in the human body. It has to. It works constantly, every time you speak, swallow, or even breathe deeply. And this is where the connection to your heart becomes so powerful. Because when your heart is healthy, when it's pumping strong and steady, that rich, oxygen-carrying blood reaches your tongue in full force. It fills those tiny vessels. It gives your tongue that soft, uniform pink color we talked about. But the moment your heart begins to struggle, the moment those coronary arteries start to narrow, the moment oxygen delivery starts to falter even slightly, your tongue is one of the very first places to show it. Before your fingertips get cold, before your lips turn pale, before you feel any pain in your chest at all. Why? Because your body is smart. When your heart senses trouble, when it realizes it can't pump enough oxygen to every corner of your body, it starts making priority decisions. It protects the essentials first, the brain, the vital organs, the core, and the smaller, more peripheral areas like the surface of your tongue are the first to lose that generous blood supply. This is called peripheral perfusion, and it's one of the earliest, quietest signals of cardiovascular distress in medicine. Now, here is something most people don't know, and it genuinely surprises even some younger physicians. Your tongue is connected to your heart through what we call the vagus nerve. This is a long, wandering nerve that runs from the base of your brain, down through your neck, and directly into your heart. It also branches into your tongue. So when your heart is under stress, when it's working harder than it should, that stress travels along this nerve pathway and shows up as subtle changes in tongue color, texture, and even the coating on top. It's like a telephone line running directly from your heart to your mouth, and most people have no idea it exists. Think about that for a moment. You have a direct, visible, real-time monitor of your heart's condition sitting right inside your mouth, and you get to check it every single morning for free, without an appointment, without a copay, without waiting 6 weeks to see a specialist. All you need is a mirror and 30 seconds. But here is the part I really want you to understand. This isn't some ancient folk wisdom or wishful thinking. Modern cardiology research, including studies from major medical institutions, has confirmed what those old doctors knew instinctively. Changes in tongue color and appearance can precede a cardiac event by days, sometimes weeks. In one observation, patients who later suffered heart attacks showed distinct tongue changes in the 2 to 3 weeks leading up to the event. Weeks, not minutes, not seconds. Weeks of warning that most people simply never noticed because no one ever told them to look. And that's the tragedy of it. We have this incredible early warning system built right into our bodies, and we spend our whole lives ignoring it. We check our phones 100 times a day, but we never check the one organ that could tell us our heart is in trouble. We worry about every ache and pain, but we walk past the mirror without a second glance at the muscle that could save our lives. So the next time you brush your teeth, I want you to pause. Just for a moment, look at your tongue, not with fear, but with respect. Because that little muscle, that quiet, unassuming messenger, may be the most honest friend your heart has ever had. And in the next chapter, I'm going to teach you exactly how to read what it's trying to say. All right, this is the part I want you to pay very close attention to. If you take notes, now would be the time to grab a pen. Because in the next few minutes, I'm going to walk you through the 4 distinct tongue colors that every adult over 55 should be able to recognize on sight. Not because you need to become a doctor, but because knowing these 4 patterns could quite literally add years to your life. Let's start with the first one, and this is the one that concerns cardiologists the most. The pale tongue with bluish or purplish edges. This is the pattern I mentioned in the opening, and I want to describe it in more detail now. When you stick your tongue out and the center looks washed out, almost like the color has been drained from it, and the sides along your teeth show a dusky, bruised, purplish tint, that is a serious signal. In medical terms, this pattern is associated with reduced oxygenation and poor peripheral circulation. In plain language, it means your heart may not be pushing oxygen-rich blood the way it should. This is not the tongue of someone who just drank a glass of red wine. This is the tongue that persists, morning after morning, regardless of what you eat or drink. And it is the tongue that should send you to your doctor within the week. Now let's talk about the second pattern, the deep red tongue with cracks or fissures running through it. When your tongue looks unusually red, almost angry red, like a strawberry, and you see small cracks or lines running down the center or across the surface, this often points to inflammation somewhere in the body. And here is what most people don't realize. Chronic inflammation is one of the leading drivers of heart disease in adults over 55. It silently damages the lining of your arteries. It contributes to plaque buildup. It sets the stage for the kind of cardiac events that seem to come out of nowhere. If your tongue looks like this, especially if it burns or feels sensitive to spicy foods, it's your body telling you that inflammation is running higher than it should. Time to talk to your doctor about your C-reactive protein levels and your overall inflammatory markers. The third pattern is one I see constantly in my older patients, and it's often dismissed as nothing: the white-coated tongue with scalloped edges. When your tongue has a thick, white or yellowish coating covering the surface, and along the sides you see indentations that look like teeth marks pressed into the tongue, this is what we call a scalloped or swollen tongue. It suggests that your body is retaining fluid, that your circulation is sluggish, and that your kidneys and heart may be under more strain than you realize. This pattern is very common in people with early-stage heart failure, and it often shows up long before the swelling in the ankles or the shortness of breath that most people associate with the condition. If your tongue looks puffy, coated, and scalloped, please do not ignore it. And finally, the fourth pattern, the dangerously pale tongue with a bluish underside. This one requires a specific check. Lift your tongue up and look at the underneath. There are two large veins running along the bottom, and in a healthy person, they should be a soft pinkish blue color. But when those veins appear dark, engorged, almost black-purple, and the top of your tongue looks pale and lifeless, this combination is one of the strongest visual indicators of significant circulatory distress. In many cases, this pattern is seen in people who go on to experience a cardiac event within weeks. It is the tongue's most urgent whisper, and if you see it, do not wait. Call your doctor, get an appointment, take it seriously. Now, I want to be very clear about something. Seeing one of these patterns does not mean you are having a heart attack tomorrow. It does not mean you should panic. What it means is that your body is trying to tell you something, and you finally have the knowledge to listen. Think of these 4 patterns as 4 different letters your heart is writing to you. The pale tongue with purple edges says, "I'm not getting enough oxygen through." The deep red with cracks says, "There's fire inside these arteries." The white-coated scalloped tongue says, "The pump is getting tired." And the dangerously pale tongue with the dark underside says, "Please, do not ignore me any longer." Here is what I want you to do. Tomorrow morning, before you eat, before you drink anything but water, before you brush your teeth, walk to the mirror. Look at your tongue in natural light. Compare what you see to these 4 patterns, and do this for 7 days in a row. Because one snapshot doesn't tell you much, but a pattern, 7 mornings of the same color, same coating, same shape, that pattern tells you the truth. And in the next chapter, I'm going to reveal the single biggest mistake almost everyone makes when they try to check their tongue. It's a mistake that hides the warning completely, and you may have been making it your whole life without knowing. Now here is where things get interesting, because even after everything I've just told you, even after you know exactly which colors to look for and what they mean, there is still one enormous problem. Most people, when they finally do take the time to check their tongue, do it completely wrong. And when you check wrong, you miss the warning entirely. You look in the mirror, you see a tongue that looks perfectly fine, and you walk away thinking your heart is in great shape. Meanwhile, the real warning was there all along, hidden by a mistake so simple you would never guess it. Let me tell you what that mistake is. Lighting. It sounds almost too simple to matter, doesn't it? But I promise you, it is the single biggest reason people miss the early signs. Most folks check their tongue under the bright yellow bulbs of a bathroom vanity, or worse, under the harsh fluorescent light of a kitchen ceiling. Those lights cast an artificial warm tone over everything they touch. They make a pale, oxygen-starved tongue look pink and healthy. They wash out the bluish edges. They hide the dusky purple tint completely. You could have the tongue of someone heading toward a serious cardiac event, and under a yellow bathroom bulb, it would look perfectly rosy. So here's what I want you to do instead. Check your tongue in natural daylight. Stand by a window. Face the light directly. Morning sunlight is best because it's the truest, whitest light you'll get all day. If you can't get to a window, at least step outside for a moment, or use a bright, cool white LED light held close to your face. The color you see under natural light is the real color. The color you see under yellow bulbs is a lie your bathroom is telling you. But lighting isn't the only mistake. Here's the second one, timing. When do you check your tongue? Most people who bother to look at all do it after breakfast, after coffee, after brushing their teeth with that bright blue mouthwash. And every single one of those things changes the color of your tongue. Coffee stains it, toothpaste coats it, orange juice reddens it. Even a glass of cold water can temporarily change the appearance of those tiny surface vessels. By the time you look, you're not seeing your real tongue, you're seeing your breakfast. The correct time to check is first thing in the morning, before food, before drink, before toothpaste. before anything touches your mouth except the air you've been breathing while you slept. That is the honest tongue. That is the tongue your heart has been writing on all night while you rested. Any other time of day, you're reading a page that's been scribbled over. And here is the third mistake, and this one really hurts to talk about. The medications you take can hide the warning. If you're on certain blood pressure medications, particularly beta blockers, they can artificially change the color and appearance of your tongue by altering how blood flows through those small surface vessels. Some cholesterol medications can do the same. Iron supplements can darken the tongue. Antibiotics can leave a coating that masks the true color underneath. Even something as innocent as a daily aspirin can subtly shift what you see. I'm not telling you to stop taking your medications. Please, please do not do that. What I am telling you is that if you're on any of these, you need to be even more attentive to changes over time. Look for shifts. Look for patterns. A tongue that used to look one way and now looks different, even slightly, deserves your attention. Because the medication may be smoothing over the surface warning, but the underlying condition is still there. There's a fourth mistake too, and this one I see all the time. People check their tongue once, see nothing alarming, and never check again. That's like taking one weather reading and deciding you know the whole season. Your tongue changes. Day to day, week to week. It reflects the shifting condition of your body. A single glance tells you almost nothing. But 7 days of glances, or 14, or 30, tells you a story. And that story is what saves lives. So let me put this all together for you. Every morning, before anything else touches your mouth, walk to a window. Stand in natural light. Stick out your tongue. Look at the center. Look at the edges. Lift it up and look underneath. Take a mental snapshot. And then, the next morning, do it again. And the morning after that. Because you are not looking for one dramatic moment. You are looking for a trend, a drift, a slow, quiet change that most people would never notice, but that you now have the knowledge to see. This one small habit, done correctly, in the right light, at the right time, may be the most powerful preventive step you take all year. And in the next chapter, I want to talk about something that makes all of this even more urgent. Because there are certain everyday habits and even common medications that are quietly making your tongue lie to you and making your heart work harder than it should at the same time. Now I want you to stay with me here, because this chapter may be the most personal one of them all. Everything we've talked about so far, the colors, the lighting, the timing, all of it matters. But there is a whole layer underneath the surface that most people never even consider. And that layer is made up of the everyday medications you swallow without thinking, the small habits you've built over decades, and the quiet choices you make between breakfast and bedtime. These are what I call the silent amplifiers. Because on their own, none of them seems dangerous, but together, they can turn a mild warning from your tongue into a full-blown emergency from your heart. Let's start with medications, because this is the one that surprises people the most. If you are over 55, chances are you take at least one prescription drug every day. Many of you take 3, 4, 5, or more, and here is what your pharmacist may not have told you. Some of the most commonly prescribed medications in America put an extra burden on your circulatory system, even as they help you in other ways. Take NSAIDs, for example. That's the family that includes ibuprofen, naproxen, and aspirin in higher doses. Millions of older adults reach for these every day, for arthritis, for back pain, for the aches that come with a body that's lived a full life. But long-term use of NSAIDs can quietly raise your blood pressure, strain your kidneys, and increase your risk of a cardiac event. And here's the tricky part. They can also cause subtle changes in the tongue, a slight paleness, a mild coating, that mimic the very warning signs we've been talking about. So you may look in the mirror and think you're seeing a cardiac warning when it's actually the pill you took last night. Or worse, you may see a real warning and dismiss it as just the pill. Then there are blood pressure medications, particularly the beta blockers I mentioned earlier. These drugs slow your heart rate and reduce the force of each beat, which is often exactly what your heart needs. But they can also change how blood flows to the tongue, making it appear slightly paler than it really is. If you're on these, you have to be more patient, more observant, and more willing to track your tongue over weeks rather than days. Diuretics, the water pills so many older adults take, are another silent amplifier. They help your body get rid of excess fluid, but they also pull water out of your tissues, including the tongue. A dehydrated tongue looks different. It can appear dry, cracked, sometimes paler than usual. And dehydration itself puts extra strain on the heart because thicker blood is harder to pump. Now let's move to habits, because this is where you have the most power. Dehydration is the quiet killer of older adults in this country, Most people over 55 walk around chronically underhydrated and don't even know it. Your sense of thirst weakens with age. You don't feel it the way you did at 30, so you sip less, and your blood thickens, and your heart works harder, and your tongue tells the story on the surface. Simply drinking enough water throughout the day, not gulping it all at once, but sipping steadily, can change the appearance of your tongue within a week. Skipped meals are another amplifier most people underestimate. When you skip breakfast or push lunch back until 3 in the afternoon, your blood sugar drops, your body releases stress hormones, and your heart works harder to keep everything stable. Do this often enough, and you're putting your cardiovascular system through small daily crises. Your tongue reflects that stress with subtle color shifts and coating changes. Poor sleep is another one. When you sleep less than 6 hours a night, your blood pressure runs higher the next day, your inflammation markers rise, and your heart doesn't get the rest it needs to repair itself. Chronic poor sleep shows up on the tongue as a deeper red color, sometimes with a yellowish coating. And finally, stress. Not the loud, obvious kind, the quiet kind. The kind that sits in your chest while you watch the evening news. The kind that keeps you up at 3 in the morning thinking about your grandchildren, your bills, your health. That kind of stress is a slow poison to the heart, and your tongue will tell you when it's building up. Here's the good news. Every single one of these amplifiers is something you can address. You can talk to your doctor about your medications. You can drink more water. You can eat regular meals. You can protect your sleep. You can find small ways to ease the weight on your heart. And when you do, your tongue will show you the improvement, often within just a few weeks. Because your body is not against you. It is trying every single day to tell you the truth. All you have to do is listen. And in the next chapter, I'm going to tell you exactly what to do in the 24 hours after you first see a warning sign on your tongue, step by step. All right? Let's say tomorrow morning you walk to the window. You stick out your tongue in that clear, honest daylight, and you see it, that pale center, those dusky purple edges, or maybe that deep, angry red with cracks running through it. Whatever the pattern, something is off. Something doesn't look right. Your heart skips a little just looking at it. Now what? What do you actually do in the next 24 hours? Because this is where knowledge either becomes power or it becomes panic. And I want it to become power for you. The first thing I want you to do is breathe. I know that sounds too simple, but I mean it. Sit down. Take 3 slow, deep breaths. Because whatever you see on your tongue is not an emergency you have to react to in the next 30 seconds. This is a whisper, not a scream. You have time. You have hours. And the worst thing you can do is spike your own blood pressure by panicking before you've even gathered information. Now, step 2. Check your hydration. When was the last time you drank a full glass of water? If it's been more than a few hours, pour yourself a large glass of room temperature water and sip it slowly over the next 15 minutes. Then wait about 30 minutes and look at your tongue again. If the color improves significantly, if the paleness fades and the natural pink returns, then dehydration was likely playing a major role in what you saw. That doesn't mean you can ignore it. It means you've learned something important about how your body is running low on fluid, and you need to build a better hydration habit starting today. Step 3, take your blood pressure. If you have a home cuff, and every adult over 55 really should, use it now. Sit quietly for 5 minutes first. Feet flat on the floor, arm resting at heart level. Take 2 readings, 2 minutes apart. Write them down along with the time. If your reading is significantly higher than your normal, or if the top number is above 180, or the bottom number is above 120, you need to call your doctor's office today, not tomorrow, today. Step 4, do a symptom pairing check. This is where you become a detective for your own body. Ask yourself these questions honestly. Have I felt unusually tired the past few days? Have I been short of breath climbing stairs I used to climb easily? Have I felt any pressure, tightness, or discomfort in my chest, jaw, neck, or left arm? Have I been waking up at night feeling anxious for no clear reason? Have my ankles been swelling? If you can answer yes to 2 or more of those questions, and your tongue is showing one of the warning patterns, that combination is significant. Write it all down on a piece of paper. Bring it with you when you see your doctor. Step 5, and this is the one that matters most. Decide whether this is a doctor's appointment or a 911 call. Here is how to tell the difference. If your tongue looks off, but you feel generally fine, no chest pain, no shortness of breath, no dizziness, no sudden weakness, then this is a doctor's appointment. Call your primary care physician today and ask for the earliest available slot this week. Tell the scheduler you've noticed circulatory changes and you'd like to be seen soon. That language matters. But if your tongue looks off and you have chest pain, or shortness of breath, or sudden weakness on one side, or slurred speech, or crushing pressure in your chest, or pain radiating into your arm or jaw, that is not a phone call to your doctor. That is a 911 call. Right now. Do not drive yourself. Do not wait to feel better. Do not call your daughter first. Call 911. Because the tongue was the whisper. Those other symptoms are the shout. And when the shout comes, minutes matter more than anything else in the world. Step 6. In the 24 hours after you see a warning sign, even if you decide it's not an emergency, I want you to be gentle with yourself. Cancel anything strenuous. Skip the heavy yard work. Postpone the long drive. Eat lightly, drink plenty of water, and go to bed early. Give your heart a quiet day. Let it rest while you gather information. Step 7. Track it. For the next 7 mornings, check your tongue in natural daylight at the same time before eating. Write down what you see. A single word will do. Pale, purple, red, coated, normal. 7 days of notes will tell you and your doctor more than 100 vague conversations ever could. Because here is the truth. The people who survive heart events are almost always the ones who acted early. Not the ones who waited to be sure. Not the ones who talked themselves out of it. The ones who saw the whisper, honored it, and made the phone call. Be that person. Your family needs you to be that person. And in the next and final chapter, I want to tell you why this matters so much more than any single tongue check. I want to end this with something honest. Something I don't say often enough to my patients, and something I wish more doctors would say to the people they care for. Ready? Here it is. One tongue check will not save your life, but a habit will. And that is the difference I want you to walk away with today. Because if you take everything I've told you in this video, all the colors, all the patterns, all the lighting tips and timing tricks, and you use it once, tomorrow morning, and then never again, then I failed you. Because your heart is not a one-time event. It is a lifelong story. And your tongue, that honest little messenger, is writing a new page every single day. What matters is not the snapshot. What matters is the pattern, the habit, the quiet, faithful morning ritual of walking to the window, looking at yourself, and asking your own body one simple question. How are you today? Really? You know what I've noticed in nearly every patient I've ever lost too soon? It wasn't that they missed one warning sign. It was that they never built the habit of looking. They lived their entire adult lives without ever once studying their own reflection with the kind of attention they'd give a stranger's face. They knew their car better than they knew their tongue. They knew their bank balance better than they knew their pulse. And when the warning came, it came to a person who had never learned to listen. I don't want that to be you. I want you to become the kind of person who knows their own body, who checks in every morning, not out of fear, but out of respect. Respect for this incredible machine that has carried you through decades of life. Respect for the heart that is beaten without a single day off for 60, 70, 80 years or more. That heart deserves your attention, and your tongue is how it earns it. Now, I want to say something to those of you watching who are not doing this for yourselves. Maybe you're watching because your husband won't listen. Maybe you're watching because your wife brushes off every symptom. Maybe you're watching because your father is stubborn, or your mother is scared, or your brother thinks he's invincible. Please, share this video with them, not with a lecture, not with a scolding. Just send it and say, I watched this today and I thought of you. It only takes 20 minutes. Please watch it for me. Because sometimes the message that saves a life is the one that comes from someone who loves them. And to those of you watching for yourself, I want to say this. You are not being paranoid by checking your tongue every morning. You are not being dramatic by paying attention. You are being wise. You are being the kind of person who takes responsibility for the one body they were given. And that is not fear. That is love. Love for yourself. Love for the people who depend on you. Love for the years you still have ahead of you. Here is what I want you to do right now before you close this video. Make a promise. Not to me, to yourself. Promise yourself that tomorrow morning and every morning after that, you will walk to a window, stick out your tongue, and take 5 seconds to look. Just 5 seconds. That's less time than it takes to check your phone. Less time than it takes to pour a cup of coffee. And it may be the single most important 5 seconds of your entire day. If you learned something today, if any part of this video made you think differently about your own health, do 2 things for me. First, hit that subscribe button, because I make videos like this every week, sharing the quiet warning signs that most doctors are too rushed to explain. Second, leave a comment below and tell me one thing. What did you notice when you checked your tongue today? Was it pink and healthy? Was it something that concerned you? Your comment might be the one that helps someone else in the comments section realize they're not alone. And finally, one last thought. The people who live the longest, healthiest lives are not the ones with the best genes. They are not the ones with the most expensive doctors. They are the ones who paid attention, who noticed the small things, who listened to the whispers before they became shouts. Your tongue is whispering to you every single morning. From this day forward, I hope you'll listen. Take care of yourself. Take care of the people you love, and I'll see you in the next video.